This is part 2 of 2 parts for chapter 6. And in this part of the skin, we're going to look at skin color and skin cancer. And if you're wondering, this is really the lecture of diagnostic value. How can we look at skin and determine what's happening with the system underneath it? So let's get started. First, melanin. We've already heard it's produced by melanocytes. It's that dark pigment. It's going to accumulate. It's going to produce a darker color to start to shield the DNA in the growing stem cells. It has 2 major proteins, eumelanin, which is brownish and black, and pheomelanin, which is reddish yellow sulfur-containing pigment. We'll revisit those when we start looking at hair color and stuff like that. But melanin is one of the most significant factor for skin color. Then you can have different types of skin color, dark skin versus light skin. It's very strange because both of them are going to have the same number of melanocytes. The only difference is the melanocytes in darker skin is going to create more melanin. Lighter skin doesn't create it as much. And most of the time when it does create melanin, it's going to be clumped. And that clumped near a keratinocyte nuclei, what happens is it looks more like a freckle. So lighter skin versus darker skin, it's just how those cells are going to produce and absorb or disperse the melanin. But melanin in both is very important, and it's going to vary with the exposure to UV light because its job is to protect the skins underneath, the cells underneath it from UV light. So the more UV light you have, the more melanin your body is going to produce. Other colors, red and blue, red and yellow at this point. And we're eventually going to look at blue. So if something looks red, it's hemoglobin underneath it. Something happened. Why is blood going too close to the surface of the skin? Why are you able to see it? Is it a burn? Or is that person just bashful or embarrassed? All of those things can cause blood to rush to the surface of the skin. You have keratin. Keratin is a yellow pigment acquired from egg yolks and yellow-orange vegetables like carrots. And if you've ever had a baby and you had a baby that only liked eating, mushed up carrots, and all you feed them is mushed up carrots, you're going to see this start to accumulate in their skin, and they're going to start looking orange or yellow from those carrots. Another thing to look at. Blue. Blueness means lack of oxygen. If you have a lack of oxygen in circulating blood, it can mean that they're choking or drowning by an obstructed airway. They might have emphysema or respiratory arrest and lung disease. Or it might just be cold. Because if you're cold, your blood is going to be shunted to the core part of your body, and it's going to be shunted away from the skin because it wants to keep the blood warm. So your tissues on the outside, your skin, will start turning blue. Also, if your heart's not beating, you will also have lack of oxygen, so your skin will turn blue. In arrhythmia, this is the redness again. Again, it could be exercise, hot weather, anger, embarrassment, and it's because when hemoglobin in the red and blood starts to come very close to the skin and showing through. And you can kind of start thinking, somebody comes into the hospital and they have blue skin or they have red skin, you can start formulating a plan on how you're going to treat these patients. Also, there's pallor. Pallor is a little different than just being a lack of oxygen. This is almost like when you see a ghost. Emotional stress, low blood pressure, circulatory shock, cold, anemia. This is where it's pale, ashen color. There's very little blood flow through the skin. So you see the dermal collagen that's becoming visible. So you see this, you're like, what happened? Albinism is then going to be the genetic lack of melanin, which results in white hair, pale skin, and pink eyes. And this is going to be inherited and it's recessive. So these two can be similar, but you should be able to tell them a difference. Then there's jaundice. This is going to be the yellowing of the skin and sclera due to excess bilirubin in the blood. Cancer, hepatitis, cirrhosis, and other compromised liver function can cause jaundice. Also, jaundice can be in a baby, a newborn. you see this buildup of bilirubin, and until they do that first poop, they're going to get rid of a lot of that, and their skin color dramatically changes. You can also have bruises, which is called a hematoma. This is a mass of clotted blood showing through the skin. And if you see a bunch of hematomas and a bunch of bruises, you kind of see something happening. Markings, friction ridges, we talked about them when we did fingerprints in the last lecture. And this is going to be a unique pattern during fetal development that remains unchanged throughout your life. So even identical twins don't have identical fingerprints. And then these lines where you flex and you bend your digits, wrists and arms, they're going to have little lines that marks the sites where the skin folds. You can have a freckle. You can have a mole. We'll look at moles when we talk about skin cancer later on in this lecture. They're black, tan, but the difference between freckles and moles, freckles are flat. Moles usually are elevated. And moles are what you want to watch out for because sometimes they can turn into skin cancer, and if they turn into skin cancer, they can become malignant. So we'll go over color, diameter, and contour when we talk about the ABCs for skin cancer. In birthmarks, hemangiomas, the patches of discolored skin caused by benign tumors of dermal blood capillaries. Some of them disappear in childhood, some last forever, but that's what a blood or birthmark is. Hair and nails. We kind of talked about some of the nails in the last lecture. We're going to repeat some of that. We're going to take a closer look at the different types of hair we have throughout our life. We're going to talk about the function and structure of them, of the hair, and the nail. The pilus is another term for hair. Pili is plural. Pili, the plural of pilus. Hair is a slender filament of keratinized cells that grows from an oblique tube in the skin called the hair follicle. You have three main types of hair throughout our life. Lanugo, fine, downy, unpigmented hair that appears on the fetus and lasts 3 months of development. So, depending on what book you read, fine, downy, unpigmented hair. If it's a preemie, the baby still might have some lanugo hair. Most of the hair is going to be vellus, and this is going to be fine, pale hair that replaces lanugo by the time of birth. So most of the hair at birth is going to be this one. In utero and in the fetus, it's going to be that one. So if you get a question that says, you have a baby, you're touching it, and it has fine hair, it's going to be vellus. And 2/3 of the hair in women, 1/10 of the hair in men. But when you're born, all of you should have this majority of this type of hair. Then eventually, when you get older, it's going to start turning into terminal hair. This terminal hair is going to be longer, coarser, and usually more heavily pigmented. That's why if you kind of see kids' hair, it might be really, really blonde when they're young. But when they become 9 or 10, they start having brown or light brown to maybe black hair. That's because it's changing into terminal hair. You have the bulb, the root, and the shaft. The bulb is where it's going to be growing. The root is underneath the surface of the skin, and the shaft is what sticks up. You have a dermal papilla, which is the bud of vascular connective tissue encased by the bulb. And then this dermal papilla is going to be surrounded by the hair matrix. The hair matrix, just like the nail matrix, is going to be the growth center for the hair. So if you see growth center for hair, it's going to be hair matrix, growth center for the nail, nail matrix. 3 layers of hair: medulla, cortex, cuticle. We'll kind of look at the medulla and the cortex and the cuticle when we look at hair color, but for right now, just know that there's 3 layers, and we'll kind of go back into it when we look at hair color. We talked about the piloerector muscle, or the erector pili muscle. We talked about how it works in goosebumps. Now we're going to focus more on texture and color. So the texture of hair is based on shape. So you take a cross section of it, straight hair is going to be round. Wavy hair will be oval. Curly hair is going to be relatively flat. Now the color is going to be due to the pigmented granules. So you remember the pheomelanin and the eumelanin we talked about with before? Brown and black hair is going to have a lot of eumelanin. Red hair is not going to have a lot of eumelanin, but it's going to have a lot of pheomelanin. Blonde hair has about the same amount of pheomelanin and eumelanin. And gray and white hair isn't caused by eumelanin or pheomelanin. This is going to be because there's going to be air in the medulla. And this is when we go back to those layers. Let's kind of look. The cuticle, cortex, and the medulla. And you can see straight hair is round. There's going to be a lot of pheomelanin and almost no eumelanin in the cuticle, cortex, and the medulla. In the cortex is where you're going to find these different types of pheomelanin and eumelanin. But here in brown to black hair, that's straight. It's going to be round, the cross-sectional view. Lots of eumelanin. Red, this is going to be wavy or curly. It's going to be oval or flat. And here you see it has the same amount of eumelanin and pheomelanin in the cortex. And then now here, with gray to white hair, you see the medulla is a lot bigger, and that's just going to be filled with air. And it starts losing all the other pigments. And that's how you tell if it's straight, wavy, or curly, if it's blonde, red, or black, or gray. So you also have other stuff. In club hair might fall out during, the older you get. We lose about 50 to 100 scalp hairs daily, and you're probably like, oh my God, that's a lot. We start growing all these hairs, and what happens with hair growth, the scalp hair grows at a rate of 1 millimeter per 3 days. Alopecia is just a thinning of hair or baldness. When you have pattern baldness, it's a condition where specific regions of the scalp are losing or thinning uniformly. It could be genetic or hormonal. Hirsutism is where you have the opposite. You actually have excessive or undesirable hairiness in areas that are not usually hairy. And what's important and what we're going to finish up this lecture with is skin cancer and burns. So skin cancer, most likely and most of the time, UV rays from the sun. Often on the head and neck because they're exposed from clothes. Most common in fair-skinned people and the elderly. Fair skin because they don't have a lot of melanin to block the damaging UV. Elderly because the more you're exposed to this, the more likely you are to get skin cancer. It's one of the most common types of cancer. Also could be the easiest to treat, all depending on how early you catch it. And it's named from the 3 different types of where the cells originate. So basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. So basal cell, least dangerous, seldom metastasized, forms in the cells in the stratum basale. This is interesting because the skin cancer forms in the stratum basale and keeps growing up. And when it's growing up, it's not going down into the blood supply so it can metastasize. And because it keeps growing up, if you catch it, you see it, you can get it removed, and usually it's the easiest to catch because you see it, and it's also the easiest to actually treat. Squamous cell carcinoma arises from keratinocytes in the stratum spinosum. There's lesions on the scalp, ears, lower lips, back of the hand. Raised, retted, scaly appearance, later forming a concaved ulcer. If you catch these early, they can be surgically removed, no problem. But these do tend to metastasize to lymph nodes, and if they go to the lymph nodes, they can go to other parts of the body and become extremely lethal and fatal. The last one's the worst, malignant. And this skin cancer arises from melanocytes. And these are often in pre-existing moles. That's why if you have a mole, you need to check it. Even though these are only 5% of skin cancer, they're the most deadly form of all skin cancers combined. They're treated surgically if caught early. They metastasize very rapidly. They're unresponsive to chemotherapy and usually fatal. And using the ABC rule is imperative for this type of cancer. So what you do, A, is it asymmetric? Yep, that's not a circle, so that's asymmetric. That failed the first A. B, border. Is the border smooth? Absolutely not. The border has little bumps. It fails the border rule. Let's move on to C, color. Are there different colors in this? See, black, purple, pink. This is redness over here. It failed the color rule. And then finally, diameter. Does it get bigger? If it's getting bigger and the diameter is increasing, you do have a malignant melanoma. That's why it's very important to memorize the ABCD rule. So if you see something on your body, you can tell if it's a cancerous, and if it is cancerous, you go to a dermatologist to get it treated. Because if you catch these early, you can treat them early and you can be saved from them. Also, persons with metastatic melanoma lives only about 6 months from diagnosis, and 5 to 14% will survive for 5 years. You can get a familiar family history of malignant melanomas, very high in men, redheads, and people who experience severe sunburn in childhood, which if you live in Florida, that's pretty much everybody. Now we're going to look at burns. So the burns are going to be classified by what depth of tissue they're involved. So first degree, partial thickness, involves only the epidermis. Because the epidermis is the first layer, that's going to be the first degree. You touch something hot, it's going to be redness, some pain, slight edema. Heals within a few days. Most sunburns are types of first degree burns. Second degree. Second degree is all of the epidermis and part of the dermis. So it goes all the way through the epidermis, all those living cells, and goes down to the dermis, and now it can start affecting some of those organs underneath it. It leaves part of the dermis intact, so it doesn't go all the way through. Red, tan, and white. 2 weeks to several months to heal, depending on how deep it is. Blisters and very painful. The final one, third degree burn. This goes through the epidermis, all of the dermis, and sometimes the hypodermis with muscles and bones underneath it also destroyed. This is going to require a skin graft. It needs fluid replacement and infection control. So third degree burn, fluid replacement, and infection control. Let's look at which one we're going to do first and why. Here's our third degree burn. It's going to go all the way through the epidermis, all the way through the dermis and the tissue underneath it. Fluid replacement and also infection. Because it goes through all these different types of layers, infections can then come from outside and start to damage the skin. But if you look at the blood vessels that are now damaged, the most important thing in a third degree burn is to make sure you replace the fluids. You replace the fluids first, then you can always go back, and in those fluids you can start putting an antibiotic drip to start dealing with the infection. But if you lose too much fluids at once, your blood cannot pump blood to other parts of the body, cannot pump it to the brain. That loss of blood pressure will then cause your brain cells to stop working. And infections, although they are important, they do take longer to take hold than you not getting oxygen to the brain. So in a third degree burn, you first have to replace fluids, and then you have to deal with the infection. And here you can see the first degree and then the second degree. And finally, third degree burns require skin grafts because you need to have to put something on top of the skin while it heals. Sometimes you can have an autograft, which is tissue taken from another location on the same person's body. It can be a foot, it can be a butt, it can be other parts of the body that are similar to that type of tissue. It can be also an isograft, a skin from an identical twin. They're also doing other types of skin grafts that are cell-grown tissues that are also being used nowadays. So all of these different things can be used in a third-degree burn. And that concludes all of our lectures on the skin. Good luck on your exam.